Does this hurt? Or does this hurt? Maybe this hurts. If you have pain at the top of your wrist when you're doing stuff like push-ups, front squats, or any other activity that requires a lot of wrist extension, you might be dealing with a condition called dorsal wrist impingement. So today's video is going to be going over the different causes of wrist impingement and how you can get started at correcting this issue. So let's get started. Dorsal wrist impingement occurs when the wrist extensor tendons get pinched by the top of your wrist. And basically what happens is the bones of the wrist pretty much pinch on the tendon because they aren't gliding or moving appropriately. This can happen anytime someone is going into repetitive wrist extension, particularly those who are doing it with high amount of stress or tension, including those who Olympic weightlift, those who serve, those who do gymnastics, or even breakdancers can deal with this issue. When it comes to recovering from this activity, there's a few things that you gotta keep in mind. One, you gotta stop irritating that tendon. And this is best done by giving yourself some relative rest, which means you will decrease the amount of activities that kind of re-trigger your pain, and you'll do alternate activities or you do modifications of exercises that you're already doing so that you're not re-irritating your tendon. This is to give that tendon an opportunity to heal and recover so that they don't stay inflamed all the time. The other thing that we gotta do is actually start strengthening the tendons of your wrist extensors. This is because all that constant pinching can cause wear and tear of that tendon, and the only thing that's going to get that tendon to rebuild itself is by strengthening it through time under tension exercises or TUT chaining. The last thing that we're going to work on is doing exercises that's going to promote proper gliding and joint motion of that wrist, and this is so that we can reduce the number of times that your wrist is going to an impingement positions. Wrist impingement usually hurts more when you're actually going through activity and usually feels better with rest. It can sometimes linger though if you push it particularly hard through those physical activities that trigger the pain. Since this condition is exercise based or activity based, it will pretty much persist as long as you're doing those activities that re-trigger the pain. A lot of the time, just resting completely doesn't really help to solve the problem. And what you'll actually notice is that by taking a few weeks off and then going back into the sport or activity that injured it in the first place, it hurts just like it did as if you didn't take a break at all. And this is because you haven't actually reconditioned or trained up that wrist to handle those types of loads appropriately. And this is why you want to take an active approach to your recovery and not just sit back and rest. So the first exercise that we'll be doing today is a strengthening exercise for the wrist extensor tendons. And the purpose of doing this is so that we can start stimulating some repair of that tendon through our natural ability to recover. So all you need is a weight. If you don't have a weight, you can use a band as well, and I'll show you how to do that in a bit, but we're going to start with the weight first. So this exercise is called the eccentric wrist extension, and it's called eccentric because that's the phase of the motion that we really want to focus on, and that's because it tends to target the tendon the most rather than the muscle. So you're just going to grab this weight and you're going to go palm facing down. So this is called a pronated grip. From there, you're just going to support your forearm on any solid flat object. So I'm using my thigh here, but you can also use a table or a bench as well. So from there, you're going to start at this bottom position. This is full wrist flexion. And what you're going to do is you're going to get your good hand, you're going to assist it by bringing it into full wrist extension, and you're going to go as high as you can without that wrist hurting. From there, you're going to take about 5 seconds to slowly lower the weight all the way down. And you should feel the muscles along the top of your forearm activating. Okay, so we're going to do it again. For this exercise, we'll want to be aiming for about 6 to 8 repetitions. And the rating of perceived exertion, which is the difficulty level of this exercise, should be at a 6 to 7 out of 10. If the exercise is easier than a 6 out of 10, basically it's not going to be enough to really stimulate the changes that we want to get in the tendon. Sure, you'll get some benefits still, but it's not going to be the fastest as possible. You also want to make sure that you're not experiencing any of that pinching pain at the top of your wrist while you're doing this. If you do experience a little bit of it, just shorten the range of motion that you're doing so that maybe don't push it up all the way into full extension, but just stop short of when it hurts that wrist. If the exercise difficulty is less than a 6 out of 10, just use a heavier weight and make sure that you're still able to do that 5-second tempo. And when we're doing 5 seconds, I mean full seconds, not 5 counts. So we really want to be counting our Mississippi. So we're going 1, Mississippi 2, Mississippi 3, Mississippi 4, Mississippi 5. And that's how slow it should take for you to complete that repetition. For this exercise, you'll be aiming for about 3 sets, and you're not doing this every day. And this is because we're going for a higher exercise intensity. So instead, we'll be aiming for a frequency of 3 times a week. So we'll be doing this every other day with a rest day in between as well. So if you guys don't have a weight at home, like I said, you could use something like an exercise band. I'm using a loop band, but you can use any type of band. And to do this, all you're going to do is anchor it down with one of your feet, and then you're just going to hold onto the band as if it were a weight. From there, you're going to just assist your hand into that full end range extension, and then you're just going to lower that fist at a 5-second tempo. Okay, now the band is actually a little interesting compared to the weight in that due to the properties of an elastic band, that the hardest range of motion will be the end range, which is actually the position we want to train the most. So it might actually be preferred to use the band over the dumbbell. It really depends on your specific situation that you got going on. In terms of reps and sets of when you're doing the band instead of the dumbbell, you're actually aiming for the same repetition, so 6 to 8 repetitions, 3 sets done 3 times a week. You want to make sure that you're at least giving yourself a minute to a minute and a half rest in between sets. And this is so that you can actually push yourself to do a higher intensity exercise. So if you find yourself not needing that much rest, you're probably not lifting heavy enough of a weight. The second last exercise that we'll be doing today is the first exercise that we'll be doing to mobilize the wrist joint. And for this exercise, you don't need any equipment at all. It's very beginner friendly, and all you really need is kind of a floor. So all you're going to do is you're going to grab the affected wrist with your opposite hand, and you're going to grab it so that you're kind of just grabbing underneath the 2 bones of the wrist. So you're just kind of grabbing it with your index finger and your thumb, and then you're just going to grip onto that while you place the palm of your affected hand onto the floor. From here, you're going to apply some downward pressure and lateral pressure as well. So I'm not just pressing down, I'm pressing this way with my hand as well into my wrist joint. And this is to kind of guide my wrist to move appropriately while I'm doing this exercise. And then from here, I'm just going to take my wrist and I'm going to just bring my forearm as vertical as possible and even leaning to the opposite side a bit as far as I can, pain-free. So it's really important that for this exercise, it does not hurt. A mild discomfort is okay, but not the pinching pain that you were experiencing when you're doing those activities like the push-up or the front squat. For this exercise, we'll be aiming for about 20 to 30 repetitions, nice and gentle, nice and slow. You don't want to rush through it. You do this once or twice daily to just kind of mobilize that wrist joints. We'll move on to the next exercise. The last exercise that we'll be doing today is going to be called a banded wrist rock. So I'm using a monster band here, but you could technically use any type of exercise band to help you with this exercise. So you use a regular TheraBand or a loop band. It doesn't really matter. All we really need to do is make sure that that band is contacting the back of our wrist when we're doing the exercise, this wrist rock. It's really important that it's going to contact the hand aspect of your wrist, not the arm aspect of the wrist. So if you're just kind of pinch your fingers like that on the wrist joint, it's going to be on the further component there. So that's where I'm placing the band. So once I have that band wrapped around the affected wrist, I'm going to place that on the ground, and I'm going to have that band being anchored down with some tension by my knee. So what this is going to do is it's going to help the arthrokinematic lining of my wrist. Basically, it's going to help my wrist to rotate and glide appropriately so that it minimizes the amount of impingement my tendons are experiencing. So as you can see, I'm anchoring the band down with my knee, and the band's wrapped around the hand aspect of that wrist joint. Once I have that, I'm going to just make sure I place my palm on the ground, and I'm just going to rock my body forwards as far as I can without it hurting, and then gently rock backwards. And what the band is doing here is it's going to help assist the arthrokinematic gliding of my wrist joint to optimize the amount of space I have at the top of my wrist so that I'm not pinching on my tendons during this movement. And what this also does is it's going to help to train your body to kind of start moving appropriately so that when you're doing these wrist extension movements in your regular activities, you're less likely to kind of be restricted in the wrist and less likely to pinch on those extensor tendons. Good. For this exercise, we like to do about 20 to 30 repetitions pain-free, and you're doing this daily. And this is so that you can facilitate proper movement through the wrist joint. There we go. Okay, when it comes to recovering from wrist impingement, it is an 8 to 12 week process. So you do want to be patient with your results. Although you should see some increased function, decreased pain, increased range of motion week to week. As always, it's recommended to get an assessment with a physiotherapist or a sports chiropractor so that you can actually get a full program of care. Likewise, if you find that you're actually not improving week to week, even in the first few weeks, get assessed because you might have some other type of condition that presents similarly to wrist impingement, but it might not actually be wrist impingement. If you have any questions with regards to this video, let me know in the comments below. Be sure to give this video a like and subscribe to my channel, and I'll see you guys next time. Peace.